couple of weeks, we've been talking about open enrollment, the time of year when you need to pick a new health insurance plan. And today we are going to talk about the health insurance marketplace with Diane Falagowski, CEO of Health Plans in Oregon, and Linda Nilsson, a licensed agent. Welcome to you both. Okay, what is the health insurance marketplace?
The health insurance marketplace it's almost, if we've actually had it for almost 13 years
Oh,
now.
wow, okay.
So it's something, I think it's been so long that people forgot what it was like before. So before, if you didn't have Medicare, you didn't have Medicaid, or you didn't have employer insurance, you pretty much were out of luck, right? You could go directly to a carrier, you could spend a lot of money for very little benefit. So the marketplace is a way, it's for folks who don't have one of those kind of more traditional options for insurance to get private insurance through the marketplace, and in this case, the marketplace also offers tax credits for people. Depending on their income, they don't necessarily have to pay all of the full amount of the premium.
Got it.
So it's an option for people that don't have other types of health insurance.
Yeah. Okay. Well, let's talk before we talk about the tax credits. Who is eligible now? So it can be anyone, correct?
So folks that don't have any insurance through their employer.
Okay.
They don't have Medicare, they don't have Medicaid. So if you find yourself that you don't have any access to health insurance, you're eligible for it.
Yeah. And you have to file your taxes.
Okay.
Yeah, that's kind of important because
Yeah.
that's how you get the tax credit.
Okay. Well, let's talk about the tax credit. Like, who is eligible for any sort of financial assistance or the credit?
Yeah, so it's based on income, and it's based on how many people in your family, and essentially there's a process. You go to the marketplace or through an agent to the marketplace and put in your income information, and then it will determine how much of a premium tax credit you get.
Okay.
Yeah, so last year, about 80% of Oregonians that applied through the marketplace, they actually got an average of $500 of tax credit, which they can use to help pay for their health insurance premium. So that's $500 every month.
Every month.
That you can use to help pay for your health insurance premium.
Got it.
Yeah.
I'm sure that's very helpful for a lot of people.
Absolutely.
When is time to enroll? It's obviously now. When's the deadline?
Well, I guess it's January 16th. So
Okay.
So if you want to be covered for January 1st, you want to enroll before December 15th. December 15th is the deadline for January 1st. And then for some of you that want to wait, you have until January 16th to be covered February 1st, 2024.
Okay. And so at Health Plans in Oregon, this is something that you help people choose a plan through this portal, right?
Yes.
Yeah.
I think it's really important to have an agent, someone who understands the landscape. I mean, it's very confusing. You can go on and shop online, but you don't really know what does that come with, what's the network, who can I go see. So those are the kinds of things, and an agent can ask really important questions to make sure that you get the best plan for you.
Yeah. I was going to ask, why it's so important to work with an agent, but you kind of just covered it. But what are some stories that you've heard from the people you've helped with in this way?
Yeah, so I've been doing this for 17 years. And one of my guys that I've helped probably about 12 years now, he actually called me up 2 weeks ago. He's like, Diane, you won't believe what happened. I'm like, okay, what happened? I was in the hospital and rehab for at least 2 months. I would have easily lost my home. If it weren't for you, if it weren't for your help, I would have lost my home. I'm like, what do you mean? It's like, do you want to know how much medical bills I had? And I'm like, well, what happened? And this guy exercises every day, eats the right food, and do all the right things. And he said all of a sudden, he had a cardiac arrest, ended up in the hospital, Providence, and on rehab for at least 2 months.
Wow.
So,
Yeah.
covered.
No, that's great. What about you, Linda? Have you enjoy working with clients in this manner?
I absolutely love working with clients. So I would say a recent example I have is someone who had the Oregon Health Plan. I think that's something we haven't talked about. There are already more than close to 70,000 people that have lost the Oregon Health Plan.
Yes.
Many of those folks make just a little too much, which means that they qualify for pretty significant tax credits through the marketplace. So I had a gentleman that I was working with, and this is important because he was a smoker, and on the individual marketplace, that's a big deal. That increases your costs a lot. But we were able to get him a health insurance plan for $50 a month. And so he was thrilled with it. He thought it would be so much more expensive. And then I had another gentleman I was able to get a plan for $20 a month. So it's that, people they're afraid of it. And until they actually go and check it out and see, what do I qualify for? You don't know. And
Yeah.
it probably isn't as bad as you think.
Yeah.
A lot of people are shocked. They're like, what, $50? And actually, it's an average of $1. A lot of people can even buy health insurance, $1.
Wow.
I think everybody can afford $1
Wow.
to get covered.
Well, tell people how they can contact you and get more information and get help.
So basically, you can go to healthplansinOregon.com. You can shop. Actually, we have a tool in there. You can plug in your information. You're able to find out how much tax credit you qualify for. Or if you prefer to talk to us, it's no cost to you. So please, we're happy to help you. 503-928-6918.
Yes. Thank you both for coming. It's always helpful information. We really appreciate it.
Thank you.